everyone, my name is Taylor Alberts and I am a senior honor student at Georgia Southern University, and I will graduate in May of 2020 with my bachelor's degree in Communication Sciences and Disorders. Today I will be presenting to you my honors research project on student perceptions of the use of therapy dogs in CSD. This project was inspired by myself and my research mentor, Dr. Janet Bradshaw, as a possible new intervention in our field of study. Animal-assisted therapy, or AAT, is a technique that trained healthcare professionals use with animals to meet goal-directed behaviors of their patients during treatment. AAT is a newer development in clinical practice. The reason why we researched this topic in particular is because we wanted to know what are the beliefs and perceptions of animal-assisted therapy of undergraduate CSDS students. Participants were undergraduate students enrolled in entry-level CSDS phonetics courses. Students ranged from 18 years to 60 years and older. We had 41 females and 1 male. The survey was adapted by Yap, Schimberg, and Williams of 2017 and is 17 questions long. It was a paper-based survey and anonymous as well. Investigators were not in the room when the survey was administered. Of interest, 4 questions noted themselves interesting. Although the majority of patients rated themselves as average to above average in question 6 about AAT, 52% of them in question 8 identified themselves as having knowledge of the difference between emotional support animals, or ESA, and therapy dogs. Understanding the difference between ESA and therapy dogs in their training and accreditation needed to become one is vital in AAT. This highlights an inconsistency with self-reporting. It may be that participants are rating themselves higher than warranted. This can be because of natural bias. Responses to question 11 underscored the lack of association between AAT and SLPs, or speech-language pathologists. Whereas other health professionals were more recognized, it is interesting that SLPs are considered in the group of rehabilitation specialists with physical therapists, but they were not as recognized as being associated with therapy dogs in clinical practice. Question 12 through 14 noted that in each clinical area, communication concerns received the lowest number of yes nominations, as well as the most number of unsure nominations. One thing to note is that out of this study, the majority of the students wanted to learn more about animal-assisted therapy, and the inconsistencies in response highlights a need for undergraduate opportunities to learn and become exposed to different aspects of clinical treatment, especially with animal-assisted therapy. Thank you for your interest and your time, and especially the opportunity to share my research with you today. Have a great day.